I'm excited to announce Dr. Brandon Hall.
All right, so this of all the lectures I give, this may be my favorite. This one's really fun, so I hope that you guys end up enjoying this as much as I do. And I'm just going to jump into it. So basically, I think the first thing I should probably warn you a little bit. Before we're done tonight, I intend to offend almost every one of you if I can. And the reason is if we don't go there, we're not going to get where we need to be. So the whole point of this is to kind of challenge the things that you know, the things that you are so certain are correct, that you're not even questioning them anymore. So if I offend you tonight, I'll apologize, but I'm doing it on purpose. This is actually right where I want to go. And we'll try to do it gently so it's not too difficult. The next thing, I just kind of want to take a little informal poll. So, if you had to grade us, and by us, let's start with society, and then we're going to grade the medical community as a whole, okay? If you had to grade us from an A to an F, and I'm actually going to have you raise your hands on this one because I kind of want to see what you think. If you had to grade us on how we're doing, first as a society, at understanding and addressing compulsive behaviors and addictions, how many of you would give society an A? Raise your hand. How about a B? Okay, I haven't had a single taker yet, for those of you who aren't watching. How about a C? Okay, I got 2 C's here. All right, how about, would you give society a D? Okay, and how about an F? So we're split about evenly between D's and F's here. So that's actually not super. How about doctors, counselors, the professional side of the world? How many of you would give us an A? B? All right, couple takers. C. Okay. D. That seems to be where the peak is. How about F? All right, so kind of the DC area. So apparently the medical crew is doing better than the rest of the world. That surprises me a little bit. All right, so let's get started here. The first part, we're going to break this into 4 parts. And the first part, we're going to kind of talk about the history, how we got where we are. The second part, we're going to kind of talk about how the brain works, because if you don't get the certain areas of how the brain works, the rest of it just won't make sense at all. And then the third part, we're going to talk about kind of a new theory on, here's what it looks like actually causes compulsive behavior and addiction, a little different than what we've been told in the past. And it's kind of an amalgam of all the theories. We're kind of pulling a bunch of stuff together. And then the last part, we're going to actually talk about treatments and things that look like, we actually think we might have the ability to treat finally, which is super cool. All right, so first thing I want to talk about is this lizard. If you don't know anything about biology, you're going to look at this gecko here and see a self-harming behavior, right? First thing that would come to your mind, if you had a very limited understanding of this gecko's world, is this gecko is self-mutilating. He is doing something that harms him. Why in the world would a gecko jettison his own tail? Why would he damage himself in that way? Isn't that kind of the question we ask about addiction and compulsive behaviors? Why would she do that to her unborn child? Why would he eat when he knows it's going to kill him? Right? Why would he be involved in this sexual addiction at the risk of losing his family? That looks like something stupid, like getting rid of your own tail. And actually, the reason behind it is almost identical. All right, keep moving. All right, here are some of the theories on addiction. We start up here, and early on, we started with some pretty out there ones, and as the years have gone by, we've sort of gotten to where they're more and more predictive. For instance, moral corruption. I remember that was kind of what I was taught as a kid. And I remember being in school and I was training, and one of the docs got busted for morphine use. Lost his license, lost his job, lost all the respect of everybody. And I remember looking at him and going, this is one of the most incredible physicians I know. He loves patients. He's brilliant. He's committed. He is not that. He is not that. He is not that. And all of a sudden the rules were wrong. As we get further down, we find that, that one sort of predicts some stuff. That one's kind of bogus, actually. This one right here, adverse childhood experiences, we'll talk about that if we can. That one predicts a lot. It's not 100%, and so it's getting a lot of pushback because there are people going, well, it doesn't apply to this guy, but that one's actually pretty good. And then we've got all these other types. This is the one that we all believe, probably. This is one of the ones I'm going to try to help pull out of your head just a little bit, that we really have a tendency to believe, and we'll get into it in a minute, that addiction is just not enough fear. If we can just jack the fear up a little bit, we can fix addiction. All right, let's keep moving. So we basically find ourselves out here in the middle of the desert trying to treat something. We've failed and failed. We're completely lost on this. Now, there's a French phrase called le recul du temps. And what it means is the perspective that comes with the distance after time passes. As you distance yourself from an event, you kind of back away from it and you get this new perspective on this event. So, what do you think? What's your feeling on this sport right here? Thumb up, thumb down. Okay. Let's talk about some other things that cultures do that we can look at because it's not part of our culture, right? That we can look at and say, I don't know about that. How about let's see, where do we want to go? There's so many examples. How about the Puritans and the witch trials? Thumbs up, thumbs down. Enlightened, idiotic. Okay. How about the Spanish Inquisition? If you're not following the church well enough, we're going to help you be more righteous. Thumbs up, thumbs down. Okay, how about you and me today and the way that we are handling addiction? In 300 years, let me propose something to you, and I'll try to make this case through the night tonight. In 300 years, when they look back on our society with le recul du temps, I propose to you that they are going to call us the most barbaric society in the history of the world. We will be looked at with way more disdain than the matadors. We will be looked at with way more disdain than those people who were burning witches at a stake. I bet we will, and I'll try to make a point on why that is. Okay, so we know we're not in the place we want to be on this. So the big question comes out is, where did we go wrong? How did we get off the road? And there are a number of things, and this could be an entire day-long discussion, this question right here. I'm going to try to do it in just a couple minutes. I'm going to point out the two things that I think are the biggest place that we went wrong, okay? Let's start with an elephant's backside, okay? I want you to imagine that you and I are zoologists, okay? And we've been assigned to study elephants. And we've studied elephants a lot. We've spent our entire college career and then gone on and got a PhD in elephants. But there's a limitation in our teaching. And that is, we have every picture of an elephant we've ever seen, every interaction with an elephant we've ever seen has been from exactly that angle. That's what an elephant looks like to you and me, okay? If somebody shows us an elephant from the side, we won't even recognize it because we've been conditioned that that's an elephant. That's what elephants look like, okay? So we get hired by a zoo, and the zoo asks us to come in and help this elephant that's losing weight. And so we walk up and we present the elephant with food. And as we're walking toward this elephant, it picks up on the fact that food's coming its way, and it begins to turn around. And as it does that, I know this is a dumb analogy, stick with me here. As it does that, it stops looking like an elephant to us. And so we kind of do this, well, I guess the elephant wasn't interested, and we turn around and walk away with the food and take it away. Are we going to have problems getting that elephant to gain weight? If that's the only way we can understand an elephant. This is where we've gone wrong. This is called a bias. Specifically, it's called a confirmation bias. Once I know something, anybody that shows me something different than what I know, I discount that. It doesn't make sense to me. And anybody that shows me something that looks like the view that I think is right, I think they're brilliant. And I pay attention to that. And scientists do this in a major way. We have a huge problem with people who aren't scientists do it, but scientists do it, which means we don't publish science that doesn't look like an elephant's butt. Does that make sense? All right. So this is where it started. This is problem number one that I'm going to point out tonight. Back in the 1800s, both the world of medicine and the world of psychiatry had a problem. In the world of medicine, there were these people who were causing trouble. They were arguing with us, and they were telling doctors and scientists, you know what? I don't think you're doing this quite right. I think you got this backward. So they had been telling us for hundreds and hundreds of years that disease was caused by something called miasmas. This, guys, is a miasma. This is actually a drawing of a miasma, okay? This is cholera. This guy is drawing a picture of what he believes caused cholera back in those days. How many of you guys agree with him that cholera is caused by invisible giant skeletons wearing a ghost thing with a gray cloud around their head? Okay, we got a couple takers here. They did. This was serious, guys. This is not, I mean, we're laughing, but this was real back then. And a bunch of really annoying guys like Louis Pasteur came out and said, I actually think disease might be caused by these things. And oh my gosh, the whole scientific community attacked him. They tore him to shreds. I mean, what kind of an idiot doesn't believe in the giant skeleton ghost dude, right? And it started a huge battle. It really did for years and years. In the end, Pasteur and his buddies won, right? Are doctors trying to cut you and let your blood out to see if they can get rid of the evil humors anymore? And actually, when they made this change, it was the first time in the history of the world that doctors have actually helped people more than they've hurt them. It's only been about 100 years and some change that going to a doctor actually could do you some good. Historically, we've done a lot more harm than good. We still do sometimes. We're not perfect, but dang it, at least this changed everything. Now, in the world of psychiatry, there were also some guys causing the same problem. One of them, interestingly, was Sigmund Freud. And they came out and said, mental illness is not caused by invisible, unidentifiable, weird, hokey, evil spirits. We know what causes it. Matter of fact, almost all of this type of mental illness is caused by these type of childhood traumas. And the psychiatric community went insane. They tore them to shreds. And the fight went on just the same way. In this situation, though, the new guys lost, and the old guard won. And Freud actually realized he was going to destroy his career if he kept going with this. And so Freud actually changed his tune and said, oh, never mind, it's not adverse childhood experiences. These women made this up. They have these fantasies about their dads. They weren't really sexually abused. And he became the father of psychiatry by selling out. And so medicine and psychiatry went like this. And have you ever noticed that in the world of medicine, there seems to be this big rift, and doctors don't tend to take mental health professionals as seriously as they should? Part of it is they're not holding themselves to the same standard. They're still chasing this skeleton guy in a lot of ways, which makes the rest of the doctors go, I'm not allowed to do that anymore. We had to quit that like 1870. How come you guys still get to chase these miasmas? Does that make sense? All right. This is the second problem. This guy's name, okay, if I'm not important enough that I actually have a nemesis, but if I were somebody that actually mattered, this would be my nemesis right here. This guy right here has probably destroyed more lives, possibly, than anyone who's ever lived. Okay? His name's Harry Anslinger. This guy, the damage he causes is almost incalculable, and yet we actually have a museum that just talks about how wonderful he is. Listen, look at this quote on him. If you can't read this, it says, "An elder statesman, a man unselfishly dedicated to human welfare and law enforcement, a public servant of sterling character and integrity, an administrator of demonstrated superb ability, a diplomat of great distinction and international renown, and a valued and true friend of pharmacy." This is actually at the DEA Museum. That's what it says about him, okay? So let's talk about him a little bit because he changed history. In 1930, Harry Anslinger had a problem. He had just inherited a major department of the U.S. government, the Bureau of Narcotics, okay? Do you guys remember what was going on in the Bureau of Narcotics in 1930? Prohibition had just ended. That was his department. So he just got this huge division. He was in charge. He had all this power, and it was about to dry up. They were about to take away all his funding, take away all the people that worked for him, and he was about to lose power. So do you know what he did? He did something brilliant. He invented a new problem. And what he did is he said, we're going to go after drugs. Now, is drugs really a problem? It is. And he decided, let's go after drugs since I've already got this department in place, let's go after drugs in the exact same way we went after alcohol. How had alcohol prohibition gone? Was that a successful? And so when he brought this up that we're going to go start attacking druggies now, everybody kind of looked at him and said, we just did that. That was horrible. It made it worse. And he went, oh, okay, well, what we're going to do is we're going to attack even harder. The reason that we didn't make it is because we didn't try hard enough. We're going to get more crazy, more aggressive. And nobody bought onto it. Doctors across the country were fighting him like dogs. Scientists were saying, this is idiotic. And he didn't give up. This guy was actually really good. He was really good at what he did. He actually started a campaign, got together with William Randolph Hearst and some big names, and basically what he told one of his guys is, we can get them to stop arguing with us if they're scared enough. We just have to create a fear frenzy. And so he started throwing out all this fear frenzy. Let me read you a couple of quotes from him. These are actually quotes from Anslinger during his time. He actually said, marijuana is a shortcut to the insane asylum. Smoke marijuana cigarettes for a month, and what was once your brain will be nothing but a storehouse of horrid specters. Hashish makes a murderer who kills for the love of killing out of the most mild-mannered man. He also had a little racist problem. He was three races he really didn't like. And he really made sure that we targeted those races in this. This is kind of interesting. One of his most famous quotes is he was really well known for saying, reefer, that's marijuana, old word for marijuana, reefer makes darkies think they're as good as white men. You guys ever heard that quote? Ow. Whoa. This is the guy that we worship, by the way. This is the guy that formed our entire drug policy. When a bunch of doctors disagreed with him, he brought charges against 20,000 doctors, over 20,000 doctors for disagreeing with him. Imprisoned a lot of them, fined the heck out of them, and said if they're scared enough, they'll stop arguing. He made sure, matter of fact, this is a quote from one of the guys that worked for him. He said, Anslinger once told me that the moral effect of these physicians' convictions would most certainly result in greater circumspection. You only have to destroy a few doctors to silence the rest. Go for the top, maximum intimidation. This was always Harry's way. Anybody who published an academic work that was critical of him, his bureau, or his philosophy had to go to prison. If you publish a work that disagrees with this man, you went to prison. Howard Diller, one of his agents, once said this, or be beheaded. This is an incredibly violent man. And he succeeded in exporting this to the whole country. Now, this was published in the Washington Post, I believe. Now, here's a good sign. This is the Washington Post's publication just a few years ago on him. So they're actually learning. This is somebody who's got the capacity to say, I was wrong. But I want to kind of go through a few of the things that Anslinger, some of the things that he left in his legacy. Number one, he's the one that developed the drug war. Clearly, history shows they did it to maintain power and money. It wasn't science-based, okay? Number two, one of his primary motives really appears to be racism. And it was really aimed at blacks, Mexicans, and Chinese. Those are the three races that he really just couldn't tolerate. He had very different rules if you were white, particularly if you were wealthy white. The way he dealt with Judy Garland was extremely different than the way he dealt with Billie Holiday, for instance. Charges more than 20,000 doctors. His big thing was to normalize and encourage witch hunts. And I think one of the things I really want to point out, I'm not going to go through this whole list, but one of the things I want to point out is once he got his DEA agents chasing these druggies, his DEA agents actually end up with double salaries. The US government paid them, and the mob began to pay them. And the mob began to give them bonuses for doing their job well. Why would they do that? Why would the mob they weren't trying to corrupt them. They weren't trying to get them to not do what they were supposed to do. They were trying to get them to do their job more aggressively and better. Why would the mob pay a bunch of DEA agents? And the answer is, it made them money. Anslinger's way of doing things made them wealthy. So literally, the US government and the mob were doing the same thing. Okay? Okay, now I want to go on and just talk about one last thing, and then we'll kind of move on. This is the Vietnam War. We actually did a test once to see if what we were doing with the drug war and what we were teaching actually works. And we could go on about this literally for a couple of days. This is just one example. Johan Hari points this out, and it's really a well put together example. During the Vietnam War, so I was taught in medical school that the most addictive substance on the planet is heroin. And I was taught about this thing called chemical hooks. If you take heroin one time, you get these chemical hooks. And if you take it one time, there's a 93% chance you will die addicted to heroin. That's the story I was told in medical school, okay? The Vietnam War happened a long time before I went to medical school, and they actually accidentally tested this. So, 2 congressmen go over to Vietnam, and they come back with really scary news. They said 15% of our soldiers in Vietnam are addicted to heroin. And when they come home, we're going to have a massive heroin epidemic in the United States. They were actually wrong. It wasn't 15%. 20% of the soldiers in Vietnam self-identified saying, I am addicted to heroin. 40% of the soldiers were using heroin at the time. So, they go home. What percentage of them continue to use heroin? They got 50? It was about 5%. Whoa, 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 whoa. 5%? That's a little different than 93%, right? What's going on here? Let's look. We actually know the answer to this. And this is part of the problem. So once Mr. Anslinger told us what science needs to look like, we started doing research. And we knew that elephants only looked like this, so we only saw the research that fit with our Anslinger point of view. Okay? That's what we do now. Once you get an idea in your head, it's really hard to see anything else. So in the 1950s and 60s, we did a bunch of experiments where we'd put rats in something called a Skinner box. And a Skinner box is a cage that literally all they can see is out one end. They can see humans. And they would put, and they were all set up differently. In this one, what you see there, you see that little tube? That's an IV line. And he's mainlining probably either heroin or cocaine, okay? And every time he hits that little lever right there, he gets a dose of either heroin or cocaine. And so we stuck these rats in these boxes, and we let them tap the thing whenever they wanted. And at first, they'd kind of just tap it once in a while. And then they started tapping it pretty regularly. And then they began compulsively tapping this. And then virtually every rat in every experiment we ever did died a drug-related death. Do you see where we got our story about chemical hooks? That makes sense, doesn't it? Except there's a major flaw in this study. And our bias didn't let us spot the flaw. Let's talk about how this flaw happened. Imagine you and I, we're going to make up a fake study. I just want to illustrate this. Imagine you and I want to study cancer, and we have a hypothesis. All right, here's our little theory, our hypothesis. We think the color red causes cancer. You guys are in trouble, by the way. we think the color red causes cancer, okay? So we set up an experiment. This is what we're going to do. We're going to take half the people in our experimental group, and we're going to make them the control group. We're going to put them in a regular colored town, okay? And the other half we're going to put in a town that's painted totally red. Everything in town is red. And we're going to see if the red people in the red town, get cancer more than the people in the regular colored town with all the colors of the rainbow. Run into a little problem as we're trying to set up the experiment. There's no mayor who's super excited about us painting his town red. And so we're having trouble setting up this experiment, okay? So we look and we try, and it's just kind of falling apart. And finally, somebody comes up to us and says, hey, I know a town that I think they'd actually give you, and you could do whatever you want with it. It's in Russia, and the town is called Pripyat. And so we go approach the Russian government and say, can we borrow this town? We're going to paint the whole thing red, and we're going to do this experiment. And they're like, oh, heck yeah, have it. Paint the town red. And so we walk in, and we fill this town with people, and we take another town somewhere else, and we fill it with the other half of the people, and we watch them over the next several decades. Do you know what would happen? We would come to the conclusion that the color red causes cancer. And do you know why? Because we didn't correct for the fact that Chernobyl is the reason that town was abandoned. Do you see how we missed a major confounding factor? So as we look at this, everybody that knows anything about this, that looks at this study from the outside is going to go, it's not the color red, it's the radiation, guys, right? As we look at these rat experiments, we found something. It's not the drug, it's the box, guys. So how's that possible? Well, it turns out if you take the rats out of the Skinner box and you put them in with other rats, almost 100% of them stop using. Virtually 100% death rate from drug use goes to virtually 0%. And they literally they had them where they actually had nipples with water bottles right there by their head, clean, water laced with cocaine. And these rats would actually go to the clean one. They'd use the cocaine once in a while, and then they'd go right back to the clean one and use the clean one. So we got some problems with our theories, right? So that's what we're going to talk about for the rest of the time tonight, is where did we go wrong and what does it actually look like, all right?